Ever pondered if the salt you sprinkle on your meals could be quietly escalating your risk of health complications? Well, a recent study from Tulane University suggests that it might be doing just that, particularly in relation to type 2 diabetes. This groundbreaking study, published in the Mayo Clinic Proceedings, is the first of its kind to explore the connection between the habit of adding salt to food and the risk of developing type 2 diabetes. The researchers' findings indicate that reducing salt intake could be a potential strategy in preventing the onset of this chronic condition. The link between salt and health issues isn't new. It's well established that excessive salt can heighten the risk of cardiovascular diseases and hypertension, but this study has taken the knowledge a step further by establishing a correlation between high salt intake and an increased body mass index, also known as BMI. So, how exactly does high salt consumption contribute to the risk of type 2 diabetes? Well, the researchers proposed several mechanisms. For starters, it can lead to weight gain, elevated blood pressure, and a disruption in metabolism. It can also trigger inflammation by disrupting the balance of gut bacteria, leading to insulin resistance and impaired glucose metabolism. But does this mean you should banish salt from your meals completely? Not necessarily. It's essential to remember that our bodies do need a certain amount of sodium to maintain fluid balance, facilitate nerve signals, and assist in muscle contraction and relaxation. However, it is crucial to be mindful of the source and amount of sodium in your diet. Consider adopting low-sodium alternatives for seasoning, as this not only promotes mindful eating but also boosts the nutritional value of your meals without compromising on flavor. So, how much salt is too much? The USDA dietary guidelines recommend that adults limit their daily sodium intake to less than 2,300 milligrams. For those with hypertension, the American Heart Association advises reducing salt intake to 1,500 milligrams daily. Remember, this includes both the salt added during cooking and at the table, as well as sodium naturally present in foods. And it's important to note that these are upper limits, not targets. In summary, the findings from Tulane University underscore the importance of reducing salt intake as a preventative measure against type 2 diabetes. It's an addition to the growing body of evidence that links excessive salt consumption to hypertension and weight gain, both of which increase the risk of developing type 2 diabetes. So next time you reach for the salt shaker, remember that a little can go a long way. And if you have questions about how your salt intake may be affecting your health, don't hesitate to seek guidance from your doctor. As always, it's better to be safe than sorry. Remember, this video is not a substitute for professional medical advice. Always consult your doctor or a qualified health provider with any questions you may have regarding a medical condition. And with that, we bid you a healthier, more mindful future.